As a nurse, what case did you find the most heart-wrenching? 1. I was working in the ED. An ambulance had just brought in a woman and an 18-month-old baby. They were both soaking wet. The woman was the baby's grandmother. She was babysitting at the home of the baby's parents. She was in the backyard and had the baby in a stroller to keep the baby safe from the pool. Grandmother had a heart attack, and as she went down, the stroller rolled into the pool. She crawled over to the edge of the pool to try to rescue the baby but died. She was found on her stomach with her arm extended into the pool. The baby was at the bottom of the pool, still strapped in the stroller. Ambulance was called by the neighbor. They were both DOA, but efforts were still made to revive them. The baby's parents walked into the ED. When she saw them, she screamed and fell to her knees. I was having difficulty processing this too. It was so surreal and sad. The parents also had a 5-year-old boy with them. I tried to occupy him. He knew something was wrong but didn't know what. That happened 20+ years ago, but I remember it like yesterday. 2. A woman who had twins refused to have a C-section when baby 2 was in distress. Baby 2 was born severely handicapped. He had no suck-swallow reflex, a vegetative state. I cared for this boy daily. Mom was clueless, thinking he would get better. About 5 months later, after lots of questions about what would happen if she ignored his alarms, I was fired from his case. 2 days later, she called to tell me he was dead. I know she killed him. 3. Mine would have to be as a student. I was working at LTC, long-term care facility, and had the sweetest little lady with beginning stages of dementia who was also bedridden due to blood clots, diabetes, you name it, and this little sweetie had it. She would always hug me every day, give me her sugarless candies that she stowed away, just the nicest woman. One day I clocked in and she had a visitor. I had never seen this man before and didn't like the looks of him. I stood at the door listening. I know I shouldn't have, but I just felt something in my gut. This man was in my little lady's room trying to get her to sign some sort of papers, not quite sure what they were for, but I could guess. So I went and got the Don and the Adon and told them what was up. They went in and spoke to the man, and I was right. That man was trying to get her to sign everything she had over to him, bank accounts, the house, everything. I found out later that he was a distant relative, not even the son or anything, and was going to take her for everything she had, which I also found out later that she had stockpiled quite a little fortune. So nurses, if you feel something in your gut, listen to it. I'm sure glad I did. 4. Our security guard took her son to an emergency room. He was prescribed medication. She took him to a pediatrician. Both hospital and doctor said the child had a virus. At 2 a.m. the night I was working, she brought her 18-month-old in because he wasn't responding well. We rushed him to the back, started in 4, drew labs and started him on antibiotics. He had purplish spots on his legs and torso, an ominous sign of sepsis. Within 45 minutes, the child was dead. There was not a dry eye in the place, and all she could say was, "I tried to help him. I took him for care." The other story is just as sad. On Thanksgiving Day, a father brought his 2-year-old in. He had inhaled an almond. They had set out a bowl of nuts for guests. His father put his fingers down the child's throat trying to get the nut out, and in doing so, pushed it farther down his windpipe. It was too late by the time he brought him in. Children have respiratory trouble first, and if they don't respond, their hearts suddenly stop. The father said, "But you have all this equipment. Why can't you save my son?" "You have all this equipment." I had nightmares for a week after. Everywhere I go, I tell parents not to give nuts or hot dogs to children under 4. These 2 events were truly devastating. 5. I was a 19-year-old student nurse. My patient was a 19-year-old girl dying from massive septicemia from a backstreet abortion. Her family kicked her out when they learned she was pregnant. They never visited her or responded to calls from the hospital. She died alone except for the nurses. A few days later, I had a woman in her late 30s going for ADC for dysfunctional uterine bleeding. She had Oops. During the DC, it was discovered she was about 3.5 months pregnant. After surgery, she was on the phone when I walked in to hear her say, "Yes, I got rid of the pregnancy. The doctor called it some kind of bleeding. Problem solved." I walked back to my instructor, told her what I had heard, and asked to take a break if I couldn't change assignments. She let me take a break but made me take care of her. The patient got technical excellent care, but I couldn't make any connection with her. I learned the rich can buy their way around most anything. These rest of us are screwed. My 19-year-old patient was one of my hardest to care for in my heart. 6. I had a 15-month-old in the ICU with congestive heart failure. She was in a tent. Long story short, she coded and died. Mom and Dad came in, and Mom held her baby and sat down to rock her. She cried while they rocked, and she didn't want to put her down. I knew it was because she knew that she would never hold her baby again. After 45 minutes, Dad finally got her to put the baby down. I had to take her to the morgue on a huge metal cart. We decided to put her in a drawer that was for limbs, so it was much smaller. She had a fever when she died, and the hardest thing I have ever done was to put that warm little body, all wrapped up in her blanket, into that cold drawer, and then shut her up inside, and leave her alone in the cold dark. 7. I worked in a rural ER. A mom brought her infant in nightly for several nights with a complaint of fever. Each time she saw a different drive, and each one wrote a prescription for the same antibiotic or instructed her to get one of them filled. She didn't. She also did not give Tylenol. Finances were not an issue. A few days later, we found out that she had decided to take her baby to the next hospital up the freeway, 50 miles away, when she found her baby unresponsive. She stopped en route and called 911 when she realized the baby had stopped breathing. Baby died of aspiration. She had vomited at home and breathed the emesis into her lungs. The mother blamed our facility for her baby's death, but the sad reality is that Mom was responsible. She never followed any of the instructions given and never filled any of the prescriptions.